welcome back to our colonoscopy preparation podcast series. I am your host, Bimal Maharzan. Today's episode is T+1 day. You have successfully completed your colonoscopy procedure. Now it's about recovery and recovering fast. So, in order to help you recover smoothly and effectively, we have prepared this podcast episode. And of course, our all sources are based on number one, my personal experience of going through colonoscopy procedure at the age of 35 and research papers and science backed evidences. Today, we will delve into various aspects of the post colonoscopy recovery phase, such as how to resume your diet, manage physical activities, and monitor for any symptoms that might need medical attention. We'll provide the practical advice on what you can do to ensure a safety and efficient recovery. And along with our podcast, we provide a detailed user guide and actionable checklist, which are available in the show notes. These resources are designed to assist you in tracking your recovery process and making sure you adhere to the best practices post procedure. This episode is particularly crucial as it addresses the immediate post procedure period. What can you expect on the first day after your colonoscopy, how to manage discomfort, and tips for reintroducing foods and activities. We aim to help you transition smoothly back to your normal life while taking care of your health. And please remember that while our podcast series and our God's Fair platform is here to guide you, it is not a substitute for a professional medical advice. Always follow the guidance of your healthcare provider, especially if you experience any significant symptoms or complications. Ready to jot down key points, we guide you through the necessary steps to ensure your recovery as comfortable as possible. Let's get started and take a closer look at what holds for your post colonoscopy procedure. And as usual, let's follow a Q&A format. And the first question is, what is the normal recovery timeline? And when should I expect to return to my regular activities? Let's start by discussing this general recovery timeline. Typically, the recovery from colonoscopy is relatively quick. Most people can return to their regular activities within 24 to 48 hours. However, your personal time may vary based on factors such as sedation used during the procedure and overall health. For example, in my case, I had to take an entire week off. My procedure was on Tuesday, but because of my inability to eat or have an appetite, I had to take the entire week off because I was really weak to get back up. And obviously, my work is a desk job. I have a leadership role then, and it required me to use a lot of my mental power. But I was really weak, so I had to take the entire week off. And fortunately, I was fortunate to have a job that requires me to take time off. But that's exactly why we are preparing this so that most people don't have to suffer too long because of lack of proper recovery. So let's move on to the diet resumption. Can I immediately return to my regular diet, or are there specific foods that I should avoid or eat on the first day after the procedure? So, moving on to your diet after the procedure, you might wonder if you can eat normally right away. While you can generally start eating more solid foods, it advisable to start with lighter meals. One key point is begin with easy to digest foods. For example, opt for soups, yogurts, or a light sandwich instead of jumping straight into heavy or spicy meals. I wouldn't start with eating pizza. I wouldn't start with eating burgers. I wouldn't start eating with red meats or any kind of non-vegetarian food. Always opting for very softer foods such as fruits or apple sauces, so on, which is energizes you, but at the same time, it's very less strenuous on the digestive system. And according to the gastroenterological recommendations, reintroducing mild foods initially can help prevent any digestive distress following the procedure, especially since your bowel has been emptied. Let's move on to answer another question. When can I resume exercise or physical work? Are there any activities I should avoid to prevent complication? So, regarding physical activity, it's important to ease back to any strenuous exercise or heavy work. It's always about gradual resumption of physical activities. For example, starting with walking or light stretching on the first day, I would avoid any vigorous activities such as running, weightlifting, or gym, or going back to the field work, which requires very heavy, strenuous work. I would avoid all that. Start with a very gentle walk, and obviously, depending on your energy level, maybe a slight jog, but nothing more than that. And the medical guidelines also suggest avoiding strenuous physical activities for at least 24 hours to prevent complications such as bleeding, especially if biopsies were taken during the colonoscopy. Moving on to the expected symptoms. The question is, what are common symptoms I might experience today and how I can alleviate them? So, first, let's talk about what you might feel today. After the colonoscopy, it's common to experience certain mild symptoms as the body recovers from the procedure and sedation. Common symptoms include bloating, gas, and mild abdominal cramps. You might feel gassy or bloated due to the air introduced into your colon during the procedure. It is normal and should subside within a day. Studies indicate that these symptoms are typical post colonoscopy due to the air inflation of the colon and generally resolve without any medical intervention. At the same time, there are warning signs that you should worry about. And the question is, what symptoms would indicate a complication from the procedure, prompting me to seek immediate medical attention? So, as I said earlier, while most symptoms are mild, certain signs should prompt immediate medical attention. Be vigilant for any severe or unusual symptoms. If you experience any severe abdominal pain, fever, excessive bleeding from the rectum, or any signs of allergic reactions, these could be a signs of complications such as perforation or infection. Clinical data suggests that these complications are rare, but when it happens, it requires urgent care to prevent any serious health complications. And obviously, about another question about bowel movement. When should I expect my first bowel movement after the procedure? What should I do if I experience constipation or diarrhea? So many patients wonder about their first bowel movements post procedure. And the key point is timing of your bowel movement can vary. You may not have a bowel movement immediately after the procedure, especially because your colon was emptied. It may take a day or two to return to normal. And if you experience constipation, Increase your fluid intake and consider mild over the counter stool softener as recommended by your health provider. For example, and also for diarrhea, stay hydrated and monitor the signs of dehydration. In my case, I didn't have any diarrhea or constipation. I think my first bowel movement was after on the second day, not on the first day. It again, all the bowel was cleansed, therefore there's nothing to excrete. And after I started eating some solid soft food, I didn't eat a lot. And that means it took some time to transit from my digestive system. And my first bowel movement was I think the second day after the procedure. And I recall not having any bleeding. So it was normal snake shape, very soft stool. And the reason why I got that, I only ate soft food. And by the time when I did the colonoscopy, I understood about how to take care of my chronic constipation. But that man also got into that. Again, the bowel movements can vary. And if you do not have a bowel movement for many days, I would recommend contacting a healthcare provider. And if you drink a lot of water, eat soft food, and sleep well, I, one should get a bowel movement within a day or two. And let's talk about medications and supplements. So, can I resume all my regular medications and supplements today, or are there exceptions? Regarding medications and supplements, the general advice is to resume them as soon as you feel able to do it. So, therefore, most medications can be resumed immediately. For example, unless your doctor has given any specific instruction to delay restarting medications such as blood thinners or diabetic medications, you should be able to take your usual doses. So, according to the post procedure guidelines, it's important to resume medications to maintain levels of essential drugs in your system, particularly for chronic conditions. And talking about chronic conditions, the usual question is the following: are there specific symptoms, issues related to chronic constipation, diabetes, heart disease that I should monitor more closely after the procedure? The key point is you must increase your vigilance for specific symptoms. For example, if you have diabetes, monitor your blood sugar levels more frequently as the fasting and the procedure may have affected the glucose control. Heart disease patients should watch for any cardiovascular symptoms such as increased heart rate or chest pain. The clinical research emphasizes the importance of close monitoring for chronic conditions after medical procedure to prevent exacerbations. And after colonoscopy, it's important to closely monitor all the symptoms, and most likely there won't be any exasperation, but in the rare cases if there are, obviously please immediately contact the healthcare provider. Your safety is paramount. And for chronic condition patients, the, the following question is again about medical adjustments. Should I make any adjustments to the medications for any chronic conditions based on my current post procedure conditions? So I admit that some of these questions have overlap or even sound redundant. But what the reason why we are answering those questions is we want to be categorically answering the concerns of the chronic patients. So here is my answer. So adjusting medications post procedure may be necessary depending on how you feel and special instructions from your healthcare provider. So this should be done in consultation with your doctor. They may change medication regimens based on your personal need, and most likely you don't need it, but always consult with your doctor. For example, patients on coagulants may need to adjust their doses temporarily if the biopsies were taken to prevent bleeding complications. And let me get back to more common theme about nutrition and hydration. The question is, how much fluid should I aim to consume today to ensure proper hydration after yesterday's prep and procedure? So hydration is a critical component of the recovery, especially after the bowel cleansing process. So aim to consume adequate fluids to restore hydration. Drink at least 8 ounces of glass of water throughout the day. More if you feel dehydrated or if your doctor recommends increasing fluid intake due to specific conditions. As I said, drink when you're thirsty and drink a little bit more. And again, instead of gulping down all the water at once, sip through the entire day. So that helps more water absorption by your internal organs or body. So what research has shown that proper hydration after colonoscopy can help replenish fluid lost during the bowel preparation and support overall recovery. Remember, we have artificially excreted and caused diarrhea to cleanse our bowel movement. So we have lost a lot of fluid during the preparation, and we need to get that back. Obviously, the reason why we have been talking about is earlier is hydration is super important, but there is a time in before the procedure and after procedure that we there was no liquid period, and that also would have impacted the hydration level of the body. Therefore, in the T+2 hours day, we talk about hydration as well, but hydration is equally important going forward on the next day after a procedure. So drink a lot of water, and what even one specific advice I like to give is from my personal experience, eat water instead of drinking water. What I mean by that is, for example, when I eat fruits, when I talk about khichdi or I have lentil soups, I'm actually eating water because those food materials have a lot of fluid content in it, and it also helps a lot to in digestion. It helps a lot in food transit, and also it has allows to form a bulk and smoother stool, which is easier to pass. So eat water instead of drinking water. That's a kind of a mantra that I use, but avoid dry foods. So I wouldn't go and eat the dry fruits, I would say, such as nuts, because it's a heavy, it's difficult to digest as well. Same time, I wouldn't go and eat pizza. I wouldn't go and eat just a plain bread. I would go eat burgers. So I wouldn't eat anything that doesn't have a lot of water content. So when I say about eat water, meaning eat food that has high water content and that is easy to digest, and that helps in hydration as well. And another about nutrition is, are there certain foods or drinks that can help support my recovery and gut health, such as probiotic and specific nutrients? As I said in the last one also, after bowel cleanse, your gut microbiome is cleansed and there is a lack of diversity in general. So therefore, when the bowel is clean, it's a right opportunity or opportune time to fill the gut microbiome with more diverse. Therefore, eating probiotics may help. So optimizing your diet procedure is crucial for speedy recovery and adjusting your gut health. So I would incorporate foods that promote gut healing and reduce inflammation. For example, food rich in probiotic like yogurt, kefir, sauerkraut, kimchi can replenish healthy gut bacteria. And anti-inflammatory foods such as ginger, turmeric, omega-3 fatty acids from fish like salmon are also beneficial. And the studies have shown that probiotics can accelerate the speedy recovery of gut microbiome after disturbances caused by bowel preparation. And some people may also request for probiotic supplementations, which can be prescribed by your healthcare provider. So always consult with them. And some may argue the validity or of the prescribing probiotic, saying that there isn't evidence, but it's some. But I think evidence is catching up. The number of resources that have been happening, which I'll talk about in future, on the gut microbiome is rapidly increasing, and there are probiotic regimens that have been tested and experimented with patients, and patients self experimenting it. For example, I asked for us probiotics supplementation when I had to take uh, the antibiotic course for my H. pylori condition, and that helped me recover fast after the probiotic condition. Again, it's always personal to personal, but this is about awareness that it's important to replenish the gut microbiome for recovery, not just short term, but the long term health of it. And obviously, the food is one, it takes time to do that, but at times, for uh, more targeted approach, the supplementations can also help. Again, always consult with doctor, and sometimes it can simply be a placebo effect. And my thought on placebo effect is that if I take something and it helps me in the recovery, and if I take something that helps me in framing my mindset into recovery, I would rather take that and not taking it at all. So that's a thought about placebo effect, and I'll talk more about that in the future episodes about how about the mindset of a patient for recovery. For now, talking about mindset, let's also talk about emotional and psychological support. And the question is, feeling anxious or down after the procedure is common. What resources are available for support if I am feeling overwhelmed or I need somebody to talk to? So, there are resources available, and most likely, if everything goes normal, you need emotional support. But something goes wrong, or always there are different layers of circles. I think it's beneficial. The inner circle, the friends and family, take always support from them. And the outer circle is obviously acquaintances, support groups, who the patients like me. I think the network within you, so have consult with them. Third is, of course, uh, have the have the professional help, such as you can talk to a therapist, you can talk to a counselor, and you can talk to a medical provider. And also, during and the self care is super important as well. Knowing that when you have anxiety, nervousness, there are things that you can do to calm yourself down. For example, which can be as simple as breathing exercises, breathing exercises, deep breathing, or yoga nidra or meditations help. And also, for some people, I think listening to music helps, and other people just getting distracted by watching a movie or going for a walk or doing other activities help. So you know that there are different circles of support that you may have. There's self-care that you can do there, and self-care that you can do, and also there is also professional help that you can avail based on your emotional needs. I would recommend it utilizing these resources. And I empathize with you that when I had the recovery, I wish I was aware of things that I could have done, uh, so that I didn't have to lose about 10 kgs in about a year, and about 10 pounds in 1 week of it. And that took me an entire 1.5 years or 2 years to recover to normal weight. Again, now let's talk about logistics right now, about follow up and results. So, when will my follow up appointment be scheduled, and how will I receive the results of any biopsies or test performed by the colonoscopy? So, understanding what to expect from follow up care is key to continuing your post procedure. So, the key point is to schedule a follow up appointment to discuss the results and any necessary steps. Usually, that that will happen 1 week or 2 weeks after, especially if the biopsies were taken. If the not biopsies were not taken and the colon is clean, I think generally there will be a follow-up to for recovery. I think it's 1 or 2 weeks. It depends upon the provider to provider. But again, typically the follow-up occurs a few weeks after the procedure and discusses that polyps or biopsies. And one final question is, based on the initial feedback from my colonoscopy, are there any immediate steps or further screenings I should prepare for? So, depending on the findings from a colonoscopy, you may need to take the additional steps. Now, number one is be prepared for further screenings or treatments if recommended by your gastroenterologist. If the polyps are removed, your doctor might schedule more frequent screenings. If there were signs of inflammation or other issues, additional diagnostic testing might be recommended. The guidelines from gastroenterological associations suggest that the evidence of finding like polyps can significantly reduce the risk of colorectal cancer progression. As I said earlier, in every podcast series, we attach two resources. One is the user guide, and second is the checklist. So we have prepared the T+1 day post colonoscopy recovery guide, which we have sections such as general recovery, dietary resumptions, activity level, and instructions, and also to added notes to make sure you what you should avoid and recommend what you should be doing for your reference. And this is a user guide that which you can take a printout and put it on a refrigerator for easy reference. And obviously, what we also believe is that we need to transform this information into action. And to make it easier to do that, some kind of gamification or some kind of easy to do things help to check things off so that it closes the loop and creates a momentum. And in order to do that, I think a checklist is a great way of creating that momentum of getting things done. And for that, we have created a checklist which has a time frame and a task, and you can do completed and also the notes associated with that. So it makes it super easy for you to convert this information in the user guide into an action. So, as we wrap up today's episode of the T+1 day check in, I hope you feel well informed and equipped to handle your recovery with confidence. We have covered a lot from how to manage a diet, hydration, to understanding what physical activities are safe to resume. We also have discussed how to monitor for any signs that may require immediate medical attention and how to properly resume your medications and supplements. Remember, the recovery process is just as crucial as the preparation and the procedure itself. By the following steps outlined in our today's guide and checklist, you're ensuring that your recovery is smooth and that you are taking the best possible care of your health post colonoscopy. Keep track of how you feel, stay hydrated, and ease back into the normal activities. And obviously, do not forget to utilize the resources we have provided, like the user guide and checklist. These tools are designed to help you navigate this recovery process effectively. And remember, if you experience any severe symptoms or if anything feels off, do not hesitate to contact a healthcare provider. Thank you for tuning in, taking part in knowing you are not alone on this journey. We are here to support you through each step of your recovery. Join us in our next episode where we will discuss the follow up care and the steps after your colonoscopy. Until then, focus on taking good care of yourself. We wish you speedy and uneventful recovery. Stay safe, stay tuned, and take it one day at a time.